that needs to join, but I don't want to hold everybody up because I know people have limited time based on what's going on. So we're going to conduct this a little bit differently than I've done in the past. The reason why is because my wife is a primary care physician who came down with the virus about almost 2 weeks ago, and is still having problems to get rid of it. She's currently hospitalized. So what I've done is, using everything I'm about to show you, we set up 2 PAs and a front desk person. They're working from home to continue to help patients and to continue to deal with things that need to be done in the practice, period. So anybody who isn't sure if they need this or not, think about what I just said, because I'm pretty sure everybody on this call needs this right now. What I'm going to do is I'm going to call into that 844 number. Please hold questions for a bit. When I call into that, and then you can send them to me and I'll open this up. When I call into that 844 number, 95% of everything you're about to hear can be customized for your practice. So, for instance, the way that I've changed my wife's practice for this is it currently makes a different announcement than it used to. We have all our calls forwarded to it, and when the calls come in, people can pick which PA they want to communicate with, or the front desk person working from home deals with whatever other types of questions they may have. You may use multiple numbers or have multiple numbers to do different types of functions. Every number we give you can be programmed with a different set of prompts, a different set of behavior, and a different set of workflow. The other thing I want to point out about the numbers that we give you before we get started is every number is non-blocking. What I mean by that specifically is if 1,000 people call because there's a problem, they're all going to get answered by CallMyDoc. We can never give a busy tone, so that's why people also use this during the day to back up the front desk. In other words, your call should never go to voicemail. It should always go to CallMyDoc, because we're going to transcribe the patient's question directly into various patient cases at Athena Health. And I'm going to show you how that works in just a minute. So let me call in here so that we start to get a feel for what this system looks like. Now, I currently have it set to after hours mode, but it kind of doesn't matter, because what's happening lately is after hours and daytime are almost the same thing with a lot of locations. So that's why a lot of people are using what I'm about to show you for also remote access. But I'll point out different things of how we're using it, how our PAs are using it, front desk person, as we go along here. So please keep in mind, everything you're about to hear can be customized for your practice.
Press 1 for English.
Presione 2 para español. Appuyez sur 3 pour le français. Drücken Sie 4 für Deutsch.
Please select an office. Press 1 for Prime Clinical Test Office. Press 2 for Athena Health Test Office. Press 3 for all.
Welcome to Athena Health Test Office. The office is currently closed. If this is a medical emergency, please call 911 or go to the nearest emergency room. If you are an existing patient or calling on behalf of an existing patient, please press 2 immediately to be. Please enter the patient's date of birth by using your keypad to enter 2 digits for the month, 2 digits for the day, and 4 digits for the year of the patient's date of birth. You have entered September 18th, 1963. If this is the correct date of birth, press 1. Please wait while we look up the medical chart for the patient. If you have an emergency and need to speak with the doctor on call, press 1. If you have a question about your schedule or to request or cancel an appointment or get directions to your next appointment, press 2. If you have a question about your bill, labs, insurance, or some other message for our office, press 3.
I'll explain more about those 3 things in just a second. Let me press 1 to leave a message for my doctor. Oh, shoot. Sorry about that. The stupid phone's got problems. I can get us to where we were pretty quickly, sorry. It's not CallMyDoc, it's this cheap phone I got.
Press 1 for English.
But if you
Please select an
It does give me a chance to demonstrate.
welcome to Athena
If you know what you want to type, you just start typing
enter
it.
the patient's date of birth by using
So as patients get used to it, they'll just do what I'm doing, which is fly through the menus by just typing
you have
things.
entered September 18th, 1963. If this is the correct date of birth, press 1. If not, please wait while we look up the medical chart for the patient. If you have an emergency and need to speak with the doctor on call, press 1. If you have a question about your schedule or to request or cancel an appointment or get directions to your next appointment, would you like us to return your call to 424-263-2017? If yes, press 1. Please speak the patient's full name slowly and clearly. When done, press any key. Then you will be asked for more information.
Carl Silva.
Now, please leave a detailed message. Please speak slowly and clearly. When done, press any key.
So as I'm talking right now, two things are happening. It's going to transcribe everything I'm saying directly into a patient case. In this case, it'll be an urgent clinical patient case. And it's also going to push this transcription with my chart to the app.
Once the doctor or office has listened to your message, we will contact you at 424-32017. You will be receiving a call back from 844-61.
Okay, so you forward your calls to your CallMyDoc system just like you would any other type of answering service. And then when the patients call in, they enter their date of birth. If there's more than one patient with the same date of birth, we'll prompt for the first three letters of the patient's last name. There's other things that we'd also do as well to help identify the patient. But the point is something important, and that's I can guarantee all of you on this webinar, if you plug this in today, patients will automatically start using it. The system you're looking at today is currently in use in 34 states, and we handle 200,000 patient calls a month. We've been in business for over 6 years, and everything I'm showing you guarantee works 100%. Some people have questions, well, is it HIPAA compliant and various other things. My point to that is that if we were doing 200,000 calls a month and we had a problem, we would be out of business in about 15 minutes. So yeah, everything you're looking at here is rock solid. When I enter my date of birth, there's 3 things I can do. First thing is, if this was set to day mode, it would say, leave an urgent message from my doctor, or if it's set to night mode or not in the office mode, it would say, press 1 to reach the doctor. Now, that can be set up and customized to say anything you want. So the way I have my wife's practice set up is it actually says something a little bit different. During the day, it's going to say, press 1 for Jennifer and press 2 for Jackie, which are the 2 PAs. They're going to get the calls immediately, and then they can respond to them through the app. Now, the reason why we don't just do live calling directly to the app is 2 reasons. First of all, you can screen your calls. Second of all, when you run everything through the app, it documents the entire phone encounter, puts it back on the patient's chart. So if for any reason somebody is no longer working at a practice, or you need to find out what the doctor did when they were on call over the weekend or whatever, it's always going to be written down for you. You don't have to do anything but read it. The second thing that they can, and we're going to go over the app in a second. The second thing they can do is they have a question about their schedule. Now, when they have a question about your schedule, we have 2 modes of operation, okay? One of which is they can press 2 and they can request an appointment, and it will transcribe it and send that appointment request directly into Athena as a patient case, which I'll show you. Second thing they can do is cancel their appointment. But again, think of us like your virtual front desk. In other words, if I try to cancel an appointment a half hour ahead of time and you have a 24-hour cancellation policy, CallMyDoc will say, I'm sorry, we can't cancel your appointment right now. Please call us back later. So it won't let them cancel if they can't because of your cancellation policy. And the third thing that we can do under there is that we can text or email them their upcoming appointment information. And not only do we send their appointment information by text or email, we also attach a hot link that they can click on, and Google Maps will give them step-by-step directions to your practice. So the first mode of operation is request an appointment. The second mode of operation is that if you have enabled at least one appointment type in your patient portal, we can actually schedule the patient over the phone. They can do their own thing by themselves. We can actually schedule up to 3,000 patients an hour on its own, and nobody has to worry about anything. So in other words, if somebody wants to call at 9 o'clock on a Sunday evening, they can still schedule, reschedule, cancel appointments, get their information about their appointment sent to them. So our self-scheduling features have two modes of operation: request an appointment or actually schedule it over the phone, which I'll show you. And the other reason, lastly, that we put so much functionality in that one prompt, because it turns out that over 40% of any calls to any front desk in the country have something to do with the schedule. So the more that we can put in there, or you can put in there, the more that patients can do their own thing without having to bother your staff. Some people will even publish their CallMyDoc 844 number on their website so that patients can call it directly 24 hours a day and do their own thing. Okay, so let's look at the app here. So if I was a PA, if I was a doctor, if I was a front desk person, I'd have the app on my phone. Now, we support Android and iPhone identically. So even though I'm going to demo it on an iPhone, I could demo it on an Android. You wouldn't see any difference in how the app works. The app is identical on both platforms. So someone who knows iPhone can show somebody how our app works on Android and vice versa. Now, the notifications that you get are programmable. I just happen to have mine set because I wanted to flash the screen, and I don't know if you guys heard it, but it said out loud, "You have a patient call." I also have mine set to text me. And hang on, I'm waiting for my screen to catch up to where I'm at here on the app. It's not the app that's slow, it's the screen display. Let me relaunch that. Hang on a second so you could see what I just did. Okay, so we got a text too. And it also notifies you on the dashboard, which is behind this, but we'll talk about that in just a minute. It can also be set to call me and remind me to open the app. So when I open the app, this screen here is what is an idle timeout. In other words, if your screen isn't locked, you need to put a PIN code back in. And the reason why this exists is that someone can't just pick up your phone and look at patient call information. So I need to rotate those dials to display it. Hopefully it's going to do it. There we go. Come on, you can do it. Sorry about this. Then I hit enter. And now that photo and name is being pulled in real time out of the chart. We don't copy this information. What we do is that we merge it in real time with the phone call information. So now I got my transcription at the bottom. One of the things that you may have heard is that we support 15 different languages. So if somebody had called in Spanish, the audio portion of this would still be in Spanish, but the text portion would be in English. I got the patient demographics at the top. I got the patient transcription at the bottom. And if for some reason the transcription is weird, now we're 95% accurate. We use exactly the same technology that's used when you see Google Home or Google Assistant on TV. So that's, it's very accurate. But the point is that sometimes a patient will call in and just say, "Call me," and that's it, hang up. Or they'll be blow drying their hair or eating a sandwich while they're trying to talk to you. So even a human being would have problems with it, so you can always play it. I wasn't talking right. But the point of this is you could screen your calls because you may be in the middle of something else when these calls are coming in. And what you do is with your finger, your thumb, your right, rotate the front of the screen from right to left with your finger. And now I've got the patient chart summary for the 3 most recent visits and the 3 most recent lab results and active medications and the whole 9 yards. So who's this patient? Why do they want to talk to me? Rotate from right to left. What's happening with this patient lately? Oops. Rotate from right to left. Boom, boom, boom. Hit take session. That indicates to CallMyDoc I'm about to work with this patient. And when I'm finished and hit close session, eventually the entire phone encounter gets documented on their chart, which I'll show you in just a second. So if I want to call somebody back, and this all call types work this way, doctor, hospital calls, whatever. You hit the phone icon, then you hit this green bar. And what it's going to do is it's going to call me first.
Enter caller.
And then it's going to use a different phone line outbound to call the patient or the other caller with the caller ID of your practice. And people are always asking me, does it show your cell phone number? It always shows the caller ID of your practice.
Hello, this is Athena Health Test Office calling you back. The doctor would like to speak with you now.
And now we're connected. Echoes just because both phones are in the same room. But that's how you call people back, because it's a conference bridge dynamically set up in real time between you and the other caller. And so when you pick up, it also launches a call to the other caller simultaneously. And then when both people are there, boom, connects them. Or it might connect you to a voicemail. See, the thing is, with our system, though, you can screen your calls. So you may not have to call a patient directly. In other words, if you click on Add Response, these are all the things the app can do on its own. And these are all the things that it can handle without you, and call the patient back and take care of everything. So in this example, I'm going to do a couple different things here. I'm going to do a refill, because it's going to send a refill to the pharmacy. And when it confirms it went there, it's going to update the patient's chart, and then it's going to call the patient back and tell them where to pick it up. And I don't have to call anybody, and it handles the whole thing for me. So let me click on Prescribe here. Now, again, it's got to pull the latest meds off the chart just in case they're updated. I could hit this magnifying glass and prescribe something new, but I'll just pick one off the list here. I'm not sure ibuprofen is the right one to be using right now. Maybe not, but, you know, we'll just do this little demo. Also, I could put a note for the pharmacist in there. And if there wasn't a default pharmacy on my chart, because it pulls your default pharmacy off the chart, or if I need to send it somewhere else, if I hit edit, I could search for and send it to any pharmacy in the country. I'm going to save that response. I'm also going to have the app call people back, the patient back with some instructions. I sent in your refill, but we haven't seen you in over 6 months. So please schedule a time to come in for medication review. Follow up. And then I'm going to click on Add Response. And hang on, I'm just waiting for the screen to catch up. I'm going to click on Request Appointment. And CallMyDoc is going to schedule this appointment for its follow-up medical appointment by itself. Now that I've got all these things set up, this empty box at the bottom, this is for you to leave notes about this call for future reference, or to leave notes to other people in the office. For instance, my front desk guy, Manuel, may be leaving a message for one of the PAs to call this patient back. Again, this is going to go into the patient case and on the CallMyDoc dashboard, but it's not going to go back to the patient. I sent in this patient's refill, but we haven't seen them in a really long time. So when you get in tomorrow, could you please call them and make sure they've scheduled to come in for a follow-up medication review? and then I'm done. Because now I hit closed session, and it's going to do everything I just told it to do.
Hello, this is the office of Athena Health Test Office returning your call. A patient at this phone number contacted us with a medical issue. We are calling back now with the doctor's answer. If you are the patient or a HIPAA-authorized individual, press 1. Athena Health Test Office has the following information for you. You can repeat this information at any time by pressing 1. Please listen to the entire message. This message has 3 parts. Part 1. The doctor has prescribed the following medicine. Ibuprofen 200 milligrams capsule. Once a day. The prescription has been sent to the pharmacy. CVS, pharmacy number 9607, located at 901 Silver Spur Road. Please call the pharmacy to confirm it is ready at 310-377-6745. Part 2. I sent in a refill, but we haven't seen you in over 6 months, so please schedule a time to come in for medication review follow-up. Part 3. The doctor has requested that you schedule an appointment. Press 1 to repeat this information. Press 2 to confirm you have heard this message. Please choose your preferred scheduling method for your follow-up appointment. Press 1 to hear the next available appointment time. Please wait while we search available appointments. The next available appointment is 9 a.m. Friday, March 27th, 2020, with John Carter 1500. Press 1 to schedule at this time. Please choose one of the following. Press 1 to confirm your... Please wait while we book your appointment. Okay, we have confirmed your appointment for 9 a.m. Friday, March 27th, 2020.
On appointments.
John Carter 1500. Please make a note of it. Would you like us to text or email you your appointment confirmation? Press 1 to send confirmation by text.
Now it's sending me all my information.
Thank you for calling. Goodbye.
Great. So you get your CallMyDoc phone number or multiple phone numbers. You send your calls to it either during the day, which would mean instead of if somebody can't pick the phone up, things should always go to CallMyDoc. After hours, or if you're not open during the day, things will go straight to CallMyDoc. Patients identify themselves using their date of birth and or the first three letters of their last name. They can do various things. Once you get the call on your app, you can then respond to the patient, have the app call the patient back, or you can call the patient back. You can do a variety of different things to make it extremely efficient. And when we're finished, everything we just did is going to go back on the chart. Now, this thing here that you're seeing on my screen is what we call the admin panel. And there's a patient case in Athena simultaneously. But I'm going to explain how this works. I can either work the patient case or I can work from here. Actually, you see my appointment's been booked right there. That's the one we just did over the phone. In any event, I can work this from here or from the patient case, but I'm just going to do something here. So let's say you have multiple people working on this. And I click on this. A couple of things happen. First of all, it changed it to my name and put a note in here. So if other people log in, they'll see that. Second thing is that when I look at the patient case, you'll see it just tagged it with my name and my note. So if somebody's working the patient cases and they go, oh, Carl's already working on that on the dashboard, so I don't need to deal with it. Now, when you click on request, you could read what the patient said and play it. The probability you're going to have to play it is pretty small, since we're 95% accurate, but again, you never know. Response is a summary of the actions that were taken with the patient, either by the PA or the front desk or the doctor or whomever was using the app. And then the session log is the detailed log of everything that occurred. What phone number did they call from? What date of birth did they put in? What time did I get the message? When did I call them back with a conference call? I sent in a refill, and I also sent them a few other things, like I wanted them to schedule an appointment, CallMyDoc scheduled them over the phone, and patient confirmed it, the whole 9 yards, and then it updated the patient case with all those different things. So let's take the patient ID number, patient case ID number that's in CallMyDoc, and we'll drop it into Athena, because this way it'll bring me right to that patient case in case task assignment overrides to send it to somebody else's inbox. I don't want to have to look for it. Okay, so here's my note, right? Again, we're going to coordinate things. So the last note is pushed back. Now, if I push more than one note, it would still push the latest note back there, okay? When I called in, you remember that it said press 3? Okay, the reason why press 3 exists is because in Athena Health, there's 12 different types of patient cases. The other reason why it exists is because patients aren't calling your office for a cheeseburger. They're calling about the same stuff over and over again. I need a refill, I need a referral, I have a billing question, et cetera, et cetera, et cetera. So we're going to map this stuff out into these different buckets. I want to point something out here that I forgot to mention earlier. If anybody else is on this call who has a different type of EMR, everything, 90% of everything you're looking at is going to be identical. It doesn't matter what EMR you use. It's just the way it interacts with the workflow on the EMR that's slightly different. But everything else we're talking about, it will be consistent across all EMRs. The other thing we do is we always take the caller's phone number down. The reason why is two major reasons. First of all, if you've been seeing a patient for a while, the possibility that their phone number they want to get called back on has nothing to do with their chart could be pretty high. For instance, they changed their phone number and never told you. The other thing is, especially lately, they want to get called back on a number that never even existed on their chart. And that's why we always take that number down, so you don't have to waste time figuring out what do I call them back with. Now, this part here, we always transcribe the questions, period. No matter what, you're going to get a transcript. You're going to get a transcription, because this could have been some other kind of question, and this you can decide what questions get pushed to your app and which ones don't. So you can make a decision on what you want to focus on, or who needs to focus on what, who's using the app. When you see this down here, you know that somebody used the app to deal with this patient and did these things. Now, the last thing was, make sure this person's been scheduled to come in. So we know they scheduled because when I click on visits, it's right up there at the top, 3/27/20, 9 a.m. So I could click on view actions and close, and I could click on scheduled if it would allow me. Well, whatever, it's acting weird again, but I'll show you the other way to do this. So maybe I close it here, or I go to CallMyDoc and I click on archive, because here's all the closure status codes. So you can either close it from here, or you can close it from the patient case, or whether you archive it from here, and this will close that patient case in a couple of minutes, or whether you close the patient case here, in any event, what it's going to do is it's going to push everything about that phone encounter back on the chart. So if I go to other documents and I click on phone message, everything about that call just got documented on their chart, whether it's after hours during the day, the PA did it, if one of the staff did it, if the doctor did it, it's always going to be here no matter what. And a couple of things about this. So the summary's at the top and the details at the bottom. And you cannot attach a voicemail yet to a patient chart in Athena, but we figured a way to do it, because when you click on View Original Image, all these blue lines become hot links back to the original recordings in a secure fashion.
Carl, so as I'm talking right now, too.
So what's going to happen is you'll have the original recordings with the transcriptions documented as well. And in addition to that, even if you were no longer a client, all this information and the recordings and everything would be available to you. We'd never delete anything. We keep everything forever, because you just never know, right? So what you're going to wind up with is something like this. Whoops. This is an example of a practice that we have in Alabama. and it's a combination of OBGYNs and primary care. We have a lot of different specialties on the system. I just like to use this one because this one has 178 providers that use this after hours, and it has 12 locations that also use this during the day. And as soon as my screen refreshes, I'm going to show you what this looks like. Okay, so here's the deal, right? You remember when I called in, I said I had an urgent message from my doctor. Even if I wasn't on the app, this box here that says urgent 31 are all the urgent messages that I need to talk to my doctor about. Now, we're not trying to replace the Athena portal or the Athena, patient case display and all this other stuff. This really gives you a different view of what's going on in your practice. These are all the things that couldn't get handled by a live person immediately. So there's various boxes here because we can take, if it's an existing patient, they put in the date of birth, we can put these into different boxes. The other thing you'll notice here is there's no box that says refill, or there's no box that says referral, because there isn't questions of that nature in the system. These boxes come and go on an as-needed basis, depending on what types of questions are in the system, and it breaks it down between Spanish and English, but again, it could be breaking it down by multiple language types. Now, other is these ones up here, whether it's a pharmacy or if it's a doctor or if it's other, these are calls that may have come in that are not necessarily attached to a specific patient. Other could be a new patient. Doctor could be, a doctor calling that they want to be able to do a call with some particular doctor. Please call me back and set up a call. Who knows what? Or maybe it's attached to could be attached to a specific chart. And then pharmacy is also the same thing. So these boxes may or may not be attached to a specific chart. I'm going to show you how you deal with that in just a minute. The other thing here is if you click on resources and metrics, you're going to know everything that's happening all the time for any calls that can't get handled by a live person. So Cahaba Medical Care uses us during the day, and so you could see here that across their locations, they send us to their after hours number, and we average 306 calls an hour at 1 o'clock in the afternoon. This down here is West End. We average 88 calls an hour at noon because they're closed at noon for lunch. But you can see various things that are going on here. Now, the other interesting kind of cool thing I want to point out about these guys is that this also illustrates what I was telling you about programmable phone numbers. So they do a lot of work for the local hospitals. So they have a UA-BMW CallMyDoc, calling number. Now, this is after hours, but some of these are run 24 hours a day. They have a nursing home number. We programmed recently a COVID-19 hotline where somebody's going to be on call during the day to answer questions. Here's their numbers for the daytime use. So if I call Centerville and I'm a doctor or hospital and no one can pick the phone up or the lines are busy, it goes to the CallMyDoc dashboard for that, or new or existing patients. Whoops. But then let's go down here a little bit. So they have various after hours lines set up because they deal with various hospitals. And so, plus there'd be a primary care and OB. So they've got an OB attending, CallMyDoc phone number. And again, these phone numbers can be programmed with different prompts, different on-call schedules, different, whatever you can imagine. So they run this OB line 24 hours a day. So today, Dr. Lincoln is on call from 7 a.m. to 5 p.m., and then Dr. Peters is on call after that. What else? There's another really a good, interesting idea here, too. Forest Lane Pediatrics in Dallas and Plano. We have several different CallMyDoc phone numbers set up for them, so I'll just point these two out because these are pretty cool. All right. If you call Dallas, well, first of all, they have multiple after hours numbers. So if I call Plano, it's going to say press 1 for the Medical City Children's 24-hour nurse line, and that'll route it directly to a hospital nurse line. Or press 2 for the Forest Lane pediatrician on call. But what I wanted to show you is that during the day, if it's a billing question or medical record question, we handle every single call. And the reason why that is because they want the front desk to be dealing with appointments or urgent problems, things like that, not something that they couldn't deal with anyways, which is retyping in a patient case about a billing question, and the billing department still having to research it and deal with it later. So this is freeing up their front desk to do things that need to be done with immediately. And point out one more example down here. Lancaster Health Center in Pennsylvania has, I don't know how many providers there, 87 or so. Now they do have a call center. Well, we back up the call center because what's happening lately is going to max out any call center too. So what will happen with the call center is anybody that's on the app, if an urgent message comes in, I could actually click on this and I could send a message to basically page any doctor that I want. But the way it's not a page because it's going to push the chart plus the message directly to the doctor's app. So if they're seeing a patient, it's still going to page them and send them that information. Now I could go on and on, but I'm not going to bother. Actually, no, I am. Hang on. Let me show you these guys here. These guys are a riot, okay? Women's Obstetric and Gynecology in Tennessee. These poor guys, first thing that happened was they got hammered with tornadoes, I don't remember, a couple of weeks ago, maybe a month ago. And they called the phone company and the electric company the next day and they said, hey, you know, when can we go back to our office? And the phone company, electric company said, we have no idea. So what we did is we configured a special number for them. And they called Verizon and said they wanted all their existing number calls to go to this number. And we were picking up every single call for them until they could go back to the office. Now, that was lucky because then this other thing rolled in recently. And every single staff and every single doctor has the app. So it doesn't matter where they are. They can still help manage and deal with labor and deliveries. And that's all I'm going to say about that. Now, do you guys have questions or let me see what I can do here. I don't know if I can just open this up. Oh, wait a minute. Elizabeth? Elizabeth, you have a question? Well, any questions? Great. So here's the last piece of information. If you don't have any questions, this whole thing has been recorded so that you can either show it to other people or you can also send it to anybody that you want. Let me tell you the last piece of information, which is actually one of our best features, okay? If you want this, to be set up for free for 30 days, you just have to fill out that form that I just put in the chat link. We don't charge any setup fees, any consulting fees, any customization fees, nothing up front. We also don't charge any one-time fees. If you came back 3 months later and said you needed 4 new phone numbers to do some of the other cool things I showed you, we're not going to get charged for that. You get a free 30-day minimum trial. We do not have the telemeds thing completely worked out yet, but it's going to be shortly. because we do everything except for the video component. I'll get back to the pricing in a second, but let me explain this. We've been looking at video telemedicine in the whole environment for about 6 years now. The reason why we never did it before is because you couldn't get paid for it. It doesn't matter what all the hype said. I spent a lot of time looking at billing and CPT codes. I know more about it than I ever want to know, and you couldn't get paid for it. So my wife is in Southern California, and telemedicine, you couldn't get paid for it unless you charged the patient cash. But the whole thing was just kind of a joke. What they did about 2 weeks ago is they eradicated anything to do with all the regulations that were written in the late 80s. So now you can actually do telemedicine with 2 tin cans and a piece of string, and it'll work. Now, what's nice about our system is, aside from the video piece, everything that happens with the patient is documented and is potentially billable. In other words, I could export this stuff to an Excel spreadsheet. So the idea is that we're adding some things that aren't fully documented in the app. For instance, this phone number is now a hot link that could launch a video conference with a patient, and we're going to work on that on the app as well. The other idea is that these boxes will change a little bit. And the reason why is because this box might say 99213. This box might say 99214, whatever the CPT code is that pays for that. And then when I clicked on export, it would export all that I could give to a biller to bill for those telemedicine type visits, because now all the rules are off. You could do it whatever way makes sense. And because we do everything that needs to be done to document an encounter so that if you get audited, it's always going to be there, we're just going to figure out an easy way to add the video component. And the way we're going to add the video component is we're going to leverage all the other video platforms that are in the market: Skype, WhatsApp, anything else that does video already for the patients, because that way the patients don't have to learn something completely from scratch by downloading a specialized app that you guys may have to use. It's not going to be specialized. Anything that does video will be available. So as soon as we figure that out, which will be in the next, 2 or 3 weeks, we're going to launch that as well. Getting back to pricing, which is a good time to talk about this, our pricing is, it's $109 for the first provider and $39 per additional provider, and that's it. It's month to month, no long-term contract, cancel at any time. $109 for the first provider, $39 per additional provider, that's it, period. Now, if you just use it after hours, it's $109 for the first provider, $39 per additional provider, that's on call. If you use it 24 hours a day, it's $109 for the first provider, $39 per additional provider per location. But I don't know of another system that could do everything that I just showed you. I'm just not aware of it. We handle over 200 practices, at least 2,000 or 3,000 doctors, and we're growing like crazy right now. So the only thing I could say is that if you fill that form out for a free trial, Athena will approve it very quickly. We're not quite in a backlog situation yet. We're doing the best we can to keep up with the fact that everybody needs this right now. So just be a little patient with us. But most of the time we can get you set up the same day or the next day you fill the form out. Again, I'm going to open this up to any questions. If anybody has any questions, there's Q&A. Okay, Elizabeth, COVID-19. I'm sorry, hang on. Elizabeth, COVID-19, you still there? Yeah, so she had a couple of things here. I'm not sure if she's still on, but I'm going to reiterate what's going on here and type it at the same time. So no setup, no consulting fee, no one-time charges of any kind, period. Okay? If you want to keep it, oops, went away. Free 30-day trial. And at the end of it, if you keep it, it's $109 for first provider, $39 per additional. And no long-term contract. Okay. So again, if you guys have any other questions, you can go to our website. I will be sending this recording out, so you can send it to other people, or you can show it to other people. If you go to our website, www.callmydoc.com, there's more information there. You can also set up a meeting or live one-on-one demo if you have additional questions. And I appreciate everybody taking so much time out of their schedule during what's going on. But I can guarantee you that this is going to help your practice, help keep it open, and allows people to work remotely and a variety of other things. So this is definitely something you should look at for your practice. Thank you again. And again, if anybody has any questions, either email me or go to our website, okay? Thanks.